The following video is for educational purposes only. Please use this information with discretion. Our intent is to help you become a more informed healthcare consumer. Ortho University presents Ganglion Cyst of the Wrist, Hand, and Finger by Dr. David Eisenhauer. And now it's time to OrthoU.
Hello, I'm Dr. David Eisenhauer. I am a board-certified and dual fellowship-trained orthopedic surgeon specializing in surgery of the shoulder, elbow, and hand. In today's video, we will discuss ganglion cysts, what they are, how to diagnose them, and how to treat them. We will give you some simple home diagnostic tools as well as some simple home treatment remedies that may save you that initial doctor's office visit. So first of all, what is ganglion cyst? This can go by other names depending on where it's located in the hand or wrist. But a ganglion cyst in general is an outpouching of the joint capsule. So within all of the joints of our body is a lubricant or a joint fluid which helps the articular surfaces, the joint surfaces, glide smoothly past one another. If some of that fluid seeps out through the capsule, which is the sac that holds the fluid within the joint, through a tiny little tear in the capsule, eventually that leaking fluid will again encapsulate itself outside of the joint. And that's what a ganglion cyst is. It's an outpouching of the joint capsule, and it's filled with joint fluid, which after time, this joint fluid kind of will thicken and become very jelly-like. It's typically a clear gelatinous fluid within this cyst. It's a benign cyst or benign tumor, some patients may call it. It's very common right here on the volar part of the wrist or on the dorsal part of the wrist. And right in these two areas, this is where we generally call it a ganglion cyst. We can see it pop up around other joints of the hand. It's firm, it's nodular, it feels like a marble or a pea sometimes, depending on its size underneath the skin. It's typically not painful per se. It's usually well fixed underneath the skin. That means it doesn't move around. And generally it's not tender to touch. In other locations of the hand, we see them right here very commonly. Here we call it a retinacular cyst. This is a tiny little ganglion cyst, essentially, although slightly different. This fluid comes from the tendon sheath, so this is an outpouching of the tendon sheath, and some of the fluid that helps the tendon glide gets caught in this cyst. Typically these cysts are very small. They feel like a BB, and these actually can be painful. They can feel like patients describe them as sometimes a pebble in the shoe. Just because of where they are with gripping and grasping activities, those can be painful. A ganglion cyst that occurs here over the end of the fingers adjacent to the fingernail is called a mucus cyst. This is slightly different as well. Although this is a ganglion cyst, this is leakage of joint fluid. This most commonly is associated with arthritis at this end joint called the DIP joint or the distal interphalangeal joint, which we'll discuss in another video. But as that joint becomes arthritic, a tear in the joint capsule can occur, some fluid can leak out, and it can form a little, it almost looks like a pimple here sometimes, except for it's got a clear, thick gelatinous fluid. Oftentimes these are very superficial. They will spontaneously rupture and drain this fluid. Sometimes it can cause some ridging in the fingernail because this cyst can push on the tissue that grows fingernail or that grows your nail plate. So how do we diagnose these? I think I've probably given you some self-diagnostic tools just by explaining what they are and where they occur. Certainly there are other tumors that can develop in the hand, and some of these are even malignant. A ganglion cyst tends to occur in one of those three areas. Occasionally we can see them over the back of the hand. Something that you can do if you really want to have a little bit of fun, and if this is a big cyst, is you can do what's called the flashlight test. So get a small pin light or a very small flashlight, go into a dark room, and if this is a big cyst, for example, on your wrist, you can hold the light up to it and see if it transilluminates. So essentially see if the cyst lights up and kind of glows red. If that's the case, that is the light trying to shine through the fluid in that cyst, and that tells us that more than likely that is a fluid-filled cyst. A solid mass or a solid tumor usually will not transilluminate. That is, you won't see the light shining through that mass. Other self-diagnostic tools, there really aren't any, unfortunately. This is kind of a diagnosis of physical exams. So if you have masses in these areas, more than likely it is a benign cyst.
We pause now with 2 minutes left in the video and ask that you open a separate browser screen and go to MoonlightOrtho.com, where you can quickly register for a free patient account and get immediate access to the final portion of this video, including home treatments and remedies, along with any additional treatments that may be prescribed or recommended in office or via telemedicine, including when it may be time to consider surgery. This also gives you full access to the entire OrthoU video library, highlighting all of the most common orthopedic conditions. Once registered on Moonlight Ortho, patients will have an all-inclusive orthopedic telehealth hub at their fingertips and can pay to be seen by a board-certified and fellowship-trained orthopedic surgeon. Moonlight Ortho is the first and only orthopedic-specific telemedicine practice where patients can be seen online by a board-certified orthopedic surgeon. Via telemedicine, patients can receive X-ray, MRI, lab, and physical therapy orders, along with prescription medications, all within 24 to 36 hours from your time of visit. Thank you for watching, and if you enjoyed this video and appreciate the free advice that our surgeons have offered you, please rate and subscribe.